You're watching CTOM TV. Knowledge is power.
George is asking, what is the best treatment for stage 4 melanoma? He's got a little detail here too, I'll just give you. He said he's done 2 years with pembrolizumab. It's now moved to the brain. He's had 5 radiation treatments, and he started ipilimumab. Sorry, George, I don't know the names of all of these, but Alex will. So he's wondering, really, is he getting the best care, I guess, right now for stage 4 melanoma, given what he's been given and what he's on now?
Well, I think that is a good question. So he didn't stratify exactly what type of melanoma he had.
Okay, stage 4 is what he said.
That's.
I know that's not a type.
No, that's its metastatic state.
Okay.
So what is important here is understanding the molecular features of his cancer. Obviously, if he's been given pembrolizumab, which is a PD-1 inhibitor,
okay.
I would assume that he had a basic molecular workup. They probably looked for the BRAF V600E. They may have looked for NRAS or KRAS, but I'm not too sure about that. So he definitely needs tumor DNA sequencing.
Okay.
You should not be treating these types of cancers without tumor DNA sequencing. And at his stage right now, given that melanoma is such a heterogeneous disease and has different genetic and molecular expressions and features in all of the different tumors, he may have BRAF positive tumors. He may have, all kinds of different variants that could be targetable or that could indicate, what sort of drugs will work and what drugs won't work. And so I would suggest getting a liquid-based sequencing assay.
Okay.
Such as Garden 360 or the Foundation One liquid.
Okay. Which we can help you with, George, if you want, or you can just call those companies and...
Additionally, there's lots of things you can do to optimize how pembrolizumab works, and one of them is combining it with ipilimumab. And ipilimumab is a CTLA-4 inhibitor. That's a immune checkpoint inhibitor, as is pembrolizumab. For melanoma, the two work best together when given together. Sequentially like this, it's the data is a little less clear.
Right.
We have seen patients benefit sequentially like this, but really the two drugs together combined with a few other drugs can really be beneficial. And I think we really saw that years ago with with the case that we had for our melanoma patient. The first use of pembrolizumab in Canada was one of our melanoma patients, and that patient's still doing very well today.
Yeah, I was just going to ask you about that, because I know that it's not uncommon for people to come to you at quite advanced stages. And so I just kind of wondered if you could say something to George about that, just because it's stage 4 does not mean things have progressed too far.
Yes, well, he does have CNS metastasis, which is a fairly advanced stage of this disease. They do tend to respond quite well to radiation treatments, but really, looking at targeted therapies are really going to be the best solution for him.
Yeah.
We don't know how well pembrolizumab and ipilimumab can cross the blood-brain barrier. They're large molecules. They're monoclonal antibodies. So we don't know, although the blood-brain barrier is disrupted in metastasis, we don't know how well they're going to penetrate. So I'm not sure if that would be effective or not without a small molecule inhibitor of some form.
And once you know the molecular features of your disease,
then we can pick one.
Yes, then all sorts of possibilities open up. Yes. So that's okay.
Thank you for watching CTOM TV. Subscribe below and stay informed.